Founded in 2001, Kid Smiles began with a small team and one dental center in Southwest Philadelphia. Recognizing the extent of the need among inner-city children, it opened a second center in West Philadelphia in 2005.
And so we were all excited when the phone rang and all four of us stood around the desk and our first person called. So we began treating patients.
Health empowerment education. We want to teach these kids that you can be responsible for your health.
Kid Smiles tackles the lack of knowledge among parents, caregivers, and educators through culturally sensitive and family-friendly oral health education. Kid Smiles currently serves a growing population of more than 60,000 low-income, underserved children who are either uninsured or underinsured.
We have such dynamic teachers that they're very good at recruiting participation.
They have little activities where they can play with the other children. They also have a young lady who comes out and teaches the children, about brushing their teeth, how important it is, how to floss, and how to take the toothbrush and go around properly. And I think that's a good thing because a lot of places you don't get that.
Teeth. On my teeth I have faces. These faces show expression. This expression is what? Is he happy, sad, angry? Sad. What about this one? Happy. What we're going to do is talk about the different types of foods that make our teeth happy or what?
Building on its successful model and with the strong support of local partners and policymakers, Kid Smiles opened a third center in the heart of Washington, D.C.'s Ward 7 in December 2010. A 2009 report from the RAND Corporation, Health and Healthcare Among District of Columbia Youth, surveyed families in Washington through focus groups and interviews who reported that oral health care is a particular problem in their communities. Kid Smiles' model utilizes an integrated program of clinical care coupled with award-winning in-house and community-based education and screenings. It is the only organization of its type that addresses all of the typical barriers to successful dental treatment in at-risk communities.
What really attracted me to work with Kid Smiles is they had a nonprofit organization, and they were mainly here to help families and the community, the education, the fact that we go to schools. I've never heard of a clinic doing that, going into schools and doing education, educating the kids as well as the teachers about oral health.
Little neighborhood access, declining reimbursement rates, and low health literacy among families present underserved children in D.C. at highest risk for oral health problems, including tooth decay and infections, chronic pain, malnourishment, poor school performance, and in rare cases, life-threatening conditions. Working with public, private, and charter schools, as well as Head Start centers and other community groups, Kid Smiles provided clinical services and education to more than 10,000 children since opening in Washington.
Growing up as a kid, I didn't know flossing was important. I didn't know brushing twice a day was important,
We hire a lot of people from the community, and we work to get them trained and educated.
We learn a lot from them about where these kids are coming from, and I've learned a tremendous amount from people who we trained as dental assistants, but what they've taught us has been priceless.
I promote Kid Smiles everywhere I go. I have their business cards. I'm always telling the mom when I see them, family members, you need to get your child to the dentist's office. It's really important.
Except the staff that I encountered while I was there, they're good people. You got to have a genuine love for what you do, and it appears that they have a love for the children, for helping out the kids.
Kid Smiles strives to serve as a stable and reliable community provider for vulnerable children that meets all of their oral health care needs. Kid Smiles' guiding principle is that no child, poor and/or uninsured, should be left without a dental health home.
Help children who need care, regardless of race or creed or color or language. Come to us if you need dental care. And while you're here, you're going to get more than just the dental care.